Texas Medical Board has disciplined 3 doctors for delayed care that led to the deaths of 2 pregnant women. Both women died during miscarriage here in Texas. Their deaths drew attention about how the state's abortion ban affected how doctors and hospitals respond to pregnancy complications. Joining us now to talk more about her latest reporting into this is Kavitha Surana with ProPublica. Kavitha, welcome back to our show and thanks for being with us again.
Thanks for having me.
So before we get into these 3 doctors in question, I'm hoping you can start by reminding us about what happened to those 2 women who ultimately died.
Right. Well, we've investigated the deaths of 4 women who died after they didn't receive timely reproductive care during miscarriages since the abortion ban went into effect. These particular cases, one involved Nevaeh Crane, who was a teenager who repeatedly went to emergency rooms trying to get help for a life-threatening infection. And she was turned away from 2, and at the 3rd, she was made to wait for 90 minutes to have 2 ultrasounds done to confirm fetal demise before they took her to the operating room, and she ultimately died of sepsis. The second patient is Portia Gumazi. She lived in Houston and was a mother of 2, and she went to the hospital basically bleeding very heavily from a miscarriage, and the proper treatment would have been to provide her immediately with what's known as a DNC, a procedure to empty the uterus and allow it to clamp down and stop the bleeding. But the doctor didn't provide that, and Portia bled to death.
I mean, just truly tragic circumstances for both of them. What are the 3 doctors accused of doing specifically in relation to those 2 cases?
Well, each case is different, as I described, and each doctor played a different role, but the board found that in all these cases, that the delays in care led to the patient's deaths.
And what are some of the consequences that these 3 doctors are facing? You mentioned in your story that was published recently in ProPublica that they got sanctions from the Texas Medical Board.
Right. Each doctor was ordered to take 8 hours of extra training and inform their employers of the judgment. We spoke with the husband of one of the women, Hope Gumazi, who felt that this really wasn't enough and wished that the board had used its power to suspend or revoke the doctor's license in his wife's case. But the lawyer representing both of these families in malpractice lawsuits saw it somewhat differently. She said that it's very rare to even see the board release discipline in many of the cases she represents, especially where there's ongoing litigation. Another thing that some doctors point out is that these kinds of disciplines actions are may be seem smaller compared to the threat of the abortion ban, which is a felony and could result in not just loss of medical license, but $100,000 in fines and prison time up to 99 years.
I mean, you touched on it a few moments ago, but I wanted to circle back on it. How are the families of the women who died reacting to this latest development?
Yeah, I think that's what I know so far is what Portia's husband has said to us, that he felt it was disappointing. He called it a slap in the face, but he is pursuing a malpractice case, and malpractice lawsuits, can have different results.
Well, Kavitha Surana, thank you so much again for joining us, and you all can read more about her story into this on ProPublica's website, so I'll direct you there, but thanks again for joining us here today.
Thanks for having me.